Hello, my name is Stephanie, and today we're with Dr. James Cahalin, SSM Health Cardinal, Glennon Pediatrician, with more than 25 years of experience treating pediatric patients in the emergency room. Dr. Cahalin specializes in treating patients who have suffered from a concussion. Today we'll be discussing concussions, signs and symptoms of a concussion, how to treat a concussion, and when to see a physician. We'll take questions throughout today's presentation, or you can ask questions in the comments area of this post. Dr. Cahalin, take it away.
Thank you, Stephanie. So today I would like to discuss pediatric and adolescent concussions, and I am one of the Cardinal Glennon physicians, and I see concussion patients 1.5 days a week, along with 2 of the neurologists in the neurology department. So I'd like to start off by saying, what exactly do we mean when we say that someone has a concussion? And this applies to pediatric, adolescent, and adult patients, and it's a little bit different than the medical concussion, but it is very similar to it. So a concussion is a traumatically induced alteration in mental status. It's usually transient, and it occurs with or without a loss of consciousness. That last part is the most important part. We used to think that concussions, you always had to be knocked out to have a concussion. Now we know that no, you don't need to be knocked unconscious. That you can still have a concussion from a regular blow to the head. It has to be induced or caused by some trauma. So I've gotten from the cdc.gov/headsup. This is one of the best sites that you can go to learn about concussions. And this is a little 30-second video on what is a concussion.
A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers.
Okay, I also brought my only audio visual that I have today. So this lemon represents the brain bathed in the cerebrospinal fluid. And as you get concussed or as you get hit in the head, the brain still moves around. So it's a little bit of a tight fit in there, but it'll give you an idea of exactly what is happening. So one of the things that people always ask me, will football helmets, the most expensive helmet, or will the headbands that kids wear for soccer, will they help protect the brain? They are going to help protect against a skull fracture, but it's very difficult to protect the brain inside. So when the blow occurs, it is still transmitted into the brain. Two other things that I wanted to show you. When you suffer a concussion, so if this is a football player or a soccer player who's heading the ball or gets elbowed in the head, right on their forehead, coup is a French word for blow, and contre coup means against the blow. So your brain is rattled in the skull, and you get hit here and also back here, so there can be damage across the brain. And conversely, if you get hit on the side of the head, if you get hit on the left side, it's going to be transmitted to the right side, and from the right side to the left side. So that's what happens with a concussion. So we talk about 4 areas of involvement from a concussion: physical, cognitive or brain-wise, emotional symptoms, and sleep issues. And we're going to go over each one of those individually. So there are 22 different symptoms that we can talk about when kids have a concussion. 10, almost half of them are caused by physical symptoms. And the most common, which I've highlighted, is a headache. Far and away, that's the most common symptom. At least about 80% of kids are going to experience a headache with a concussion, and adults and adolescents. They also will describe pressure in the head, which is oftentimes right around the vomiting, dizziness, blurry vision, balance problems, noise sensitivity, light sensitivity, and a slowed down feeling. The cognitive symptoms are going to be difficulty concentrating, difficulty remembering, confusion, a feeling of I just don't feel right in the brain or in my brain, and feeling like they're walking around in a fog. Those are words that kids use and that they describe to me. So this difficulty concentrating and difficulty remembering, school-wise, what that means is that most of the patients who sustain a concussion are going to have trouble with math and science, the two subjects that require the most in-depth connections and thinking. I have some children who have problems with reading and social studies, but far and away it's difficulty concentrating and remembering. So the emotional symptoms that the kids describe can often be fatigue and low energy. They're just more emotional. They can become irritable and angry, sad, anxious, and nervous. And when I examine the pediatric and adolescent patients, I ask the parents about everything that the kids say, but this is the one area where I really want to get the parental input, because the mothers and fathers, especially the moms, are going to notice the emotional changes that are occurring in their children. And the sleep issues, we talk about insomnia, which we define both as an inability to fall asleep as well as waking up 1, 2, or 3 or more times during the night, and excessive sleepiness. The worst case I ever saw was a soccer player who would normally sleep about 8 hours a night, and when she sustained her concussion, she slept 18 hours a day. She would go to bed at noon, get up at 6 p.m. That's very unusual, but most of the kids do have some excessive sleepiness or some insomnia. Now, we also question our patients regarding their current level of physical activity as well as their current cognitive activity, cell phone usage and texting. And I do have some of my patients who admit that yes, when they text, they do get a headache or they become dizzy or something like that. Computer, tablet, iPad usage, how much TV they watch, if they're able to read. Sometimes the black letters on a white background actually will worsen the symptoms. And if they have a game system at home, and if they're able to play that game system. So initially when I see patients, a lot of them will tell me in the first couple of weeks after a concussion, they can't do any of these things for longer than 5, 10, 15 minutes, and it will cause symptoms. And before they go back to school, we also like to have them reading, so we'll start them out reading at short periods of time. So when your child has a concussion, the current recommendations are that they have an initial period of cognitive and physical rest for 2 to 3 days. So if you have a son or daughter who gets concussed on a Friday, we basically want them to rest for the first 1 to 2 days. So we don't want them to go outside and to play more soccer, more football, or whatever. We encourage them, though, to become gradually and progressively more active, and we have them stay below their cognitive and physical symptom exacerbation threshold. So that means we don't want them exercising or doing anything that's going to tax their brain, give them a headache, or make them feel worse. In real life, we also want to increase their heart rate by having them walk or use an exercise bike in the first week, and we want to keep their